All right, so we're going to be having our first panel of the day here to wrap up our morning session. And we're going to have each of the individuals speak briefly, but then the majority of this session will be focused on questions and answers. It's my pleasure to introduce our what we're calling Survivorship Panel. So individuals are going to be focusing on wellness and the time after treatment is done. So closest to me here is Anyani Partida. She is a social worker who many of you are probably familiar with through her work with our head and neck cancer program. She also runs our support group that meets once a month. So if you're unfamiliar with the support group and you're interested in that, please talk to Anyani and she can give you the details on that. All right, next to Anyani is Akos, who is a patient who is going to talk a bit about his journey and survivorship. And then on the far end of the podium is Lily Lamb, who is a nurse practitioner in our head and neck cancer program. She works with our surgical team predominantly, but she has been working with our head and neck team for about, I think, 8 years now. So she can provide a lot of information from that perspective. So what I'd like to do is actually let's start with the patient perspective. And if you'd like to just share a little bit about your experience, your journey, your survivorship, and how you find wellness at this stage of your recovery.
Good morning, everyone. It's a pleasure to be here. And I guess we all have our own stories. From the very beginning, this was, of course, a very shocking event in my life. Of course, as all of you didn't see this coming. But then, once we swallowed it and we tried to swallow it relatively fast, things, once we got the diagnosis, thanks to Stanford, happened pretty fast with the initiation of the treatment, preparing for the treatment, going through the final diagnosis, histological diagnosis, sampling and all that stuff. And then we try to focus from the very beginning, to put behind that trauma, when facing with the first verdict, and to focus on prepare the best possible way to the treatment. And of course, I'm sure all of you went through, this is a trivia, we all wanted to start the treatment as soon as possible, correct? For many reasons. And during that time, I think it was really important for us, all the support that we got here from the different caregivers in regards to how to prepare for the pain, how to prepare nutrition-wise, in addition to the usual things, how to prepare for the chemotherapy, how to prepare for the radiotherapy. I didn't go through surgery, but of course, many of you probably did, and how to prepare for the surgical intervention. And the preparation was extremely helpful. I mean, I'm a physician myself, but when you are at the other side, it's just, you completely forget about that, I was just a patient, and regardless with my health background, I really very much needed that support that I gave here with all these different features. And again, besides the conventional path, if I may say that, preparing for my radiotherapy and preparing for my chemotherapy, I think it was extremely important, equally important for me to get a similarly high standard care here with the oftentimes, dismissed other support, namely, what will happen with your speech, what will happen with your swallow, what will happen with your pain, how you have to prepare nutrition-wise for what comes later. And preparation was very important. And with that, I think for a very, very long period of time, pretty much through the treatments, we didn't have much problem. Some things started to came, of course, through treatment, especially with radiotherapy, wounds in your mouth, pain, some pain, problems with, how to eat, how to swallow. But most of the problems for me personally came way after I completed my treatment. And I tend to think that that was partly due to this really thorough preparation, which prolonged this really worst part of my treatment. And, all of us had not more than one really bad episodes, but I finished my treatments 3 years ago in August. I completed my radiotherapy. You never forget the day. And then 1 month later, I completed my immunotherapy. And really the worst part came in November to me, once I thought, everything is behind me. And I really had a hard time with pain and with swallowing. And I really at the very, very bottom of that journey. You have your own stories where, just carrying through a day was really bad. I don't remember anymore because we, all, thank God the human brain is, you leave the bad parts behind, and I don't want to waste too much time on that, but yeah, I remember those days when I just couldn't even have 4 Nutri-Drinks, correct? Which is, I'm a metric, so that's 2 deciliters. But I just couldn't have 4 of those in 24 hours. It took me an hour to drink a single Nutri-Drink. 2 hours walking up and down, and try to push it down. And one lesson for me was that with all this help and adequate preparation that came much later, I tend to think, than it could have come, and hopefully didn't last as long as it would have lasted without all this support. And maybe I stop here, and sorry if it was a little lengthy, but these are my quick thoughts.
Thank you so much. Anyani, do you want to kind of pick it up there? Because I think there's a natural transition to what you didn't want to talk about, which is some of those darknesses and emotional things. And I know you deal with this a lot with our patients. Can you talk a little bit about that?
Hi, everyone. My name is Anyani. I am the social worker for head and neck oncology here at Stanford. Really part of what my primary role is here is to provide emotional and practical support to patients and their families and caregivers. And, going through cancer treatment, of course, there are a lot of ups and downs that come with that. But there are also a lot of supports available, both when you are, just kind of getting your diagnoses, when you're going through treatment, and then after as well. Part of the resources available, and I'll kind of touch upon some of the ones available here at Stanford. There are some great ones outside as well that I'll touch upon too. But kind of the primary thing to remember is everybody's situation is different. Everybody kind of will need different supports at different times. So if at any point you are feeling, I think some feelings of sadness and anxiety are normal with a diagnosis. But if you start to feel that you are really getting to a dark spot, or you're not really able to kind of cope, or the things that you've done in the past aren't really helping as much, please reach out to your treatment teams. They can get you connected with me, or if you're, I know not everybody's a Stanford patient, they can get you connected with another oncology social worker. And we can talk one-on-one about your individual situation and really get you connected to those resources that are going to be helpful to you. One of the resources here at Stanford that is really great is we do have a support group that meets once a month. It is online through Zoom. So for those people that are joining us online as well, you don't have to be local in order to join. We meet the first Tuesday of every month. It's from 4 to 5:30. And really, this is a really great place to be able to connect with others. Support groups have been proven to help, to help you feel less isolated. It can help you improve your coping skills and really just kind of reduce those feelings of isolation. Ideally, everybody has loved ones that have been supporting them, but sometimes it's helpful to be able to speak to somebody that really gets it, that really has been there. And so and we have people kind of from all different stages of the cancer journey, people that are, kind of at the beginning of diagnoses, people that are going through active treatment, and people that are done with treatment. We have people that are, 2, 5, even 10 years out. So, even if you are, a few years out from your treatment and you think, well, I don't know, I encourage you to come join us. You may, be able to connect with others and, learn some things that maybe you don't know, or be able to share some of that wisdom that you have gained throughout this journey. If you are interested in joining, I'm sure my information will be somewhere, but you can send me an email. I have an email distribution list. I send out an email the week before the support group with the link. And then the week after, I also send up a follow-up email with any resources or presentations that were given. So even if you're not able to join every month, you'll still be able to gain some valuable information. And my email is Partida, that's APARTIDA @stanfordhealthcare.org. And I'll be around after as well. So if you have questions or would like me to repeat my email, you can let me know. There are a bunch of other resources I can touch upon, but I'll pause for now and then I can share some of those a little bit later on as well. Thank you.
Okay, thank you. Lily, can you talk a little bit about the nurse practitioner's role in the head and neck team and some of the things that you commonly see in survivorship with your patients?
Sure. So, hi, everyone. I'm a nurse practitioner. We also have other advanced practice providers, including physician assistants. I was specifically trained as a nurse practitioner. I've been working with the head and neck surgical team for about 8 years, and you may have seen my face around. I'm always in the hallway. I work with all the interdisciplinary teams like our speech team, our radiation, and our medical oncology team. Part of my role is to work with our surgeons. Most of the time, patients come in with a head and neck diagnosis or undiagnosed with a head and neck cancer through sort of the surgical route. That's usually how the referrals come in. So we're part of the initial team that sees you. Whether you end up having surgery or just chemoradiation, usually the surgeon and the surgical team still involved. How I play a role in survivorship is I see patients in adjunct with our surgeons, with our radiation oncologists, with our medical oncologist, and I see patients in their interval visits. So I know some of our patients are here, and you have seen me before. If there's any concerns for a cancer recurrence or concerns related to your treatment, I address them in the clinic. And if it needs to be escalated, I'm also available to do that. I know some of our presenters have talked about, some of the side effects from their cancer treatment, some of these being like osteoid necrosis, swallowing dysfunction, dry mouth, mental, psychosocial, depression, not having support teams, right? They're feeling down. They don't know how to, is there someone else going through these same programs? So I'm sort of an avenue and a channel where I'm able to recognize which resources may benefit you. So if some patients are saying, I'm suddenly having lots of coughing or pills don't go down the same way, I would go in and say, do you have an established speech language pathologist? Let's connect you to the one. So I'll put in the referrals and do all of that. If you are in sort of a phase where maybe something in your life has happened and is contributing to maybe depression or anxiety, I send a message to Anyani, who meets with our patients, and I put in a referral to her. She'll recognize whether or not maybe a psych on consult would be available or helpful, and we can put those orders in. And then she can also connect you to the support group and whatnot. Or vice versa. If a patient has issues with their dentition, we put in the referrals to the appropriate provider. Patients who have neck dissections or have had musculoskeletal pain, we put in the referrals to physical therapy and whatnot. So that's kind of how a role of a advanced practice provider. Myself, I'm a nurse practitioner. We have physician assistants in our clinic as well, and we are part of your care team.
Great. So I think we'll open to questions after we give Lily a round of applause. So if you have any questions for the panel, please raise your hand. And I'm going to ask one while we wait for people to think about what they might want to ask. So Akos, I think one of the things that you have done successfully that many people struggle with is sort of reintegrating back to work after cancer treatment. Can you talk a little bit about what that was like for you?
Yes, I think that was very important. There are two things with that. I think one thing that we underestimated, and again, it's always, I encourage all of us, to ask and talk and ask and maybe ask the same question many times again if you're still unsure. But one thing we largely underestimated when to get back to work. Our original perception for actually a pretty long time was that you complete your radiotherapy and then in 4 to 5 weeks you're okay to go back to work, and that was really not the case. Correct? My estimation was that by October, again, I started my journey end of May, June, completed therapy in September. I thought I would be back to work in October. Well, November, I couldn't get out of bed, technically. But again, once, and the change came really interestingly from one day to another or 1 week to another in mid-December. All of a sudden, pain just started to be much, much better. Eating, everything started to be from really 1 week to another much, much better. Then I immediately started to plan to get back to work. Back in the days that was still under the pandemic, home office was, of course, an excellent opportunity to do that. And of course, you may not always have that flexibility. My workplace accommodated, that they said, okay, even if you come back 30%, that's good for us, because we just need people to be around that we don't want to have complete beginners. But so I was lucky. I know many people are not that lucky with the work and with home office and all that stuff. So you have to take that with salt and grain. But it was important, coming back to your point, it was important as soon as I felt strong enough, relatively strong. I don't say I was fully fit, but relatively strong enough mentally, especially, it was good. Even if I was locked in the same house, correct? It was good to be out, to catch up, and get back to your, or one's somewhat more daily routine. And that's just the interaction as well, work-related or not work-related.
Anyani, do you want to comment on that too? Because you may have some other thoughts.
Yeah.
Thank you.
Thank you. Yeah, just while we're on the topic of, kind of returning back to work, there can be a lot of questions as well. And like you mentioned, sometimes you're not ready to go back like you expect it to be. So if you have questions regarding disability benefits, if you're here in the state of California through SDI or even Social Security, if that disability is expected to last longer than a year, I am a resource. If you have questions, I'm able to help guide you and answer some of those disability questions, and then also point you in the right direction. Like I mentioned, there are some great resources outside of Stanford as well. One of them being, and I will kind of put these together and then send them to Heather to send out. But one of them is a great organization called Triage Cancer. They have free education on legal and practical issues. And particularly one of the great programs that they have is they have a legal and navigation program that offers one-to-one help with issues such as work, health and disability insurance, finances, estate planning. So they really have a great resource. And I kind of wrote some down. The other one is there is the Job Accommodation Network. They specifically provide free and confidential guidance on job accommodation. So even if you are, planning on getting back, but you are not 100%, you're going to need some accommodations, they're able to provide some guidance as well. So I know there's a lot of information out in the internet and it can be hard to locate those specific resources. So again, I am really good at finding those down and being able to kind of help guide you on what's going to be most helpful. So please, if you are having any of those questions, even if you're out of treatment, I'm still available to help. And I will put together some of those resources that can be sent out as well.
Lily, any thoughts about return to work and challenges you see on the surgical end?
I will say we do a lot of initial disability paperwork for surgery. We have sort of an expected timeline, maybe not realistic sometimes, But we are willing to sort of discuss on an individual one-on-one basis with the patient. Like, obviously, if they're struggling with post-op pain, or maybe their post-op course was a little different and extended because of wound care or whatnot, then we may extend disability and help with that paperwork to support that. When it comes to our patients not knowing what to navigate, there's different forms, FMLA, EDD, long-term, short-term disability. That's when we kind of pull on Anyani to come in and help us sort of navigate through that. And then from our team perspective, we provide sort of the medical forms, maybe a letter just to kind of support maybe asking for more time for disability. So the surgical team starts the initial disability paperwork, and then depending on whether or not you need additional care, we work with the other teams that are part of your care team. So if you need radiation, we sort of help transition. The radiation team kind of manages that. And then we chat with them. We have conversations about you all all the time, either via our staff messaging or just in discussion, that maybe this person needs a little bit more time and we should extend disability for this and whatnot. We're only allowed to extend to what the state also. So I think that's just the caveat, is that sometimes it's not in our hands of how much, when you can return to work, or how much disability pays. There is a limit, but I think having those resources like triage and the work accommodations, I think would be really helpful if you did have specific questions about that. So I would definitely explore that with Anyani.
It's pretty exciting, though. So I was going to put in a plug for the support group. In terms of folks engaging, let's say, well past their, just call it the treatment process, the recovery process, their experiences are incredibly valuable for somebody new to this process. And there's a whole bunch of, like me personally, fulfillment and satisfaction I can get out of making anybody's journey through this process a little bit better. I'm not a medical professional. I'm not a psychologist, but it's been my experience that in the support group, the stage of stage of treatment makes a huge difference in terms of what you need psychologically. The stage of recovery you're at makes a huge difference psychologically. And it also is the case that everybody's different. The people that you resonate with may not be the people that you're interacting in the support group. So a broad spectrum of people to, let's say, choose from who have experienced your journey but are ahead of you in the process makes it really, really helpful to get engaged. I was really fortunate to engage with somebody pre-support group and then engage with a lot of great people during the support group. So I'm just a huge endorser. So thank you.
Yeah, I just wanted to make a comment to you, Anyani, about a resource that really, from one of your colleagues, I can't remember who it was, but when we started treatment a number of years ago, we lived just, I think, 42 miles away from Stanford. Okay, so we were within the radius where you were not given priority to stay on campus, but the social worker said, in your 7-week radiation concurrent chemo, by week 3 it's going to get really rough. And so that social worker somehow was able to get us into on-campus housing for the bulk of the treatment, and that made a huge difference, an enormous difference. And I just want to express our appreciation for that, for being able to avail ourselves of that resource. Thank you.
Thank you. Yeah, I'll add, there are, kind of a lot of really great resources, throughout all the different stages. So if you are, struggling, if you're at the beginning and you are wondering, how am I going to make it here every day for radiation treatment? Sometimes the treatment teams are really great about flagging people who they may think are going to need additional assistance, but of course they're not able to, flag everybody. So I would encourage everybody to speak up. I think that's a huge part. If you are struggling with anything, whether it's lodging, transportation, finances, the treatment team doesn't always know what's going on, once you get home. So please let them know. They'll get you connected. Like Lily said, she'll get you connected to, kind of different treatment teams, or they'll get you connected to me, and we can explore what's available. Now, I in a perfect world, there would be, an unlimited amount of resources that fits everybody's needs. Now, I will preface by saying, unfortunately, that's not the case, but I am, happy to help and try to figure out what we can get that might be available.
Maybe just a quick comment. I think that's a very important resource, to chat with whoever is ahead of you. And because there are so many practical things that you can pick up. I mean, quick things that pop into my mind is what to eat. You hear from your providers, oh, I heard, you want to try, I don't know, these berries because the taste, people tend to say me was better. But these are small things, but, you can pick up maybe one, with your oncologist, that tip or idea too. But when you are with your fellow patients, you can really talk it over. I mean, quick, for me, milk was a life-saving thing, and anything milk-based, crepe or pancake, for weeks I survived only on that because it was, high calories, a lot of protein. But these there's no other source, correct, to talk this over. What was good for you, what was good for somebody, and you can try. Maybe it's not good for you, but you can pick something that you otherwise would never pick. The other thing, very briefly, was the gadgets. I'm not a gadget person. I don't want another app on my phone, and I think most of us are like that, correct? But the exercises and to support to do your exercises as a swallow, and I'm still doing it after 3 years, and I'm not. You can ask my wife, what do I do for exercise? Nothing, or anything. I do nothing. But this was important for such a lazy bone like me to keep. And thanks to Heather and the team and the gadget which helps. It was a pain in the neck sometimes to calibrate and all that stuff, but overall helped me to keep it even today as my daily routine. And it that small thing matters in the end because I can swallow better. My neck is much better than it should be without that. So that's key to that. Sorry.
No, that's great.
Good morning, everybody. So, my name is Jess Paniagua. A lot of you know me from last year. So what I've done is I've made myself available to a lot of the patients that have the same symptoms that I had, that need somebody that has the same issue. Because I've talked to some of the nurses, and they told me, they said, what you do is different than what we do. We don't know what it feels like. Don't know what you're going through. So what I want to do is I want to get with Anya and be able to give myself the opportunity to speak with this. Easier if I talk like this, to be able to give myself, because I've spoken with Jocelyn, Maya, and Teresa, so I make myself available to patients anytime they're here at Stanford and they've gone through a laryngectomy, they're looking for the DEP, and I talk to them and I tell them, whatever you need, ask me, I'll come and visit you, we can talk. And I've been told a couple of times, you're going to go in, this person is depressed, okay? You may be there in there 2 minutes. And I was in there for 2 hours because it uplifted them to hear it from somebody that has what they have. And like your support group, which would be great. And I'd like to see, and zoom in on it. But it's different when it's a one-on-one and it's an upfront person that you see. And sometimes I feel bad because I've met two families so far from the patient because they have questions, but they want to see you one-on-one. And right now, I have a patient, and the poor thing lives out in Fresno. So I told her, I said, you're real far from me because I live in the Bay Area, and I would love to come see you. I said, but make yourself, whenever your appointment is, call me. I will make myself available to come and speak with you and talk with you. And then when I talked to Todd today, he uplifted me because this is what we need. A group like this, symposiums like this, that help people, because everybody is different. The doctor said he feels more uplifted when somebody talks to him in a group. The gentleman that just referred the group, that's awesome. I love it, because it made him feel better. And it makes me feel good to see that there are groups like this, but I just wanted to let you know I'm going to be able to speak with you after. Thank you.
Thank you. Yeah, no, I think you kind of hit all the points and touched on the importance. It's just so important to be able to connect with others that, have gone through that same experience. The support group just meets once a month, but another great program that I'll highlight that is one-to-one that you may even want to join as a mentor is there's a great organization called Immerman Angels. They provide one-to-one peer support. And the great thing about this program is that it's not just for patients, it's for family members and caregivers as well. So for example, if you are a spouse that's helping your loved one through treatment, you can request an angel mentor as well, and they will connect you with another spouse that is also helping their loved one through treatment. So that way you also have somebody to talk to that gets what it's like to be on the caregiver family member perspective. But yeah, I don't think I wrote their number down, but I will send all those resources as well. So if you want to join either as becoming a mentee, you feel like you want to talk to somebody one-on-one that's further down the cancer journey, if you yourself are already further down the cancer journey and you want to connect with others and provide your expertise, I think that, there's great benefits to both, right? Being able to be the mentor or being able to receive assistance from a mentor. Again, I particularly love this agency because, again, not just for patients, but caregivers as well. So I think that, this cancer affects everybody, right? Not just the patient, but the entire family and loved ones as well. So if you yourself are needing some additional support too, they're a great one as well. And then Stanford does also have a general caregiver cancer support group that just recently restarted. So there is support, for family members and loved ones as well.
Let's talk a little bit about caregivers since we went there. What do you think, Akos, in terms of what was important for you when you were going through your treatment from your caregiver? What were the supports that were most important? What are things that other caregivers might learn from your experience?
Yeah, it's a tough question, but maybe two things. One is really try to use all the different disciplines. I keep repeating myself, but I really found that important. So, nutrition, palliative, your physicians, the radiologist, the radiotherapist, the oncologist, your surgeon, your speech therapist, your nutrition. It's already 6 different. But I think what was important, try to ask similar questions from different people because they're overlapping expertise. So pain-wise, I found it very useful that I did not rely only on the palliative, I didn't rely only on my oncologist, I didn't rely only on my radiotherapist, but a little bit of everybody. And, that I found important and needed. So don't be shy to ask questions that you think it's not the right person to ask because each and every has their saying, which could be very useful. And the other thing was what I really overall found really useful is being a physician to forget about you are not a physician. And, you try to be smart. You sit down to the computer and especially, you try to be smart. But once you reach the point when, and I was able to reach that point, but you can put that aside and you can completely rely on, as any average person, on your caregivers. I think that was really the most important that I could get here. I didn't need to be smart. I could just be a patient and rely on, on my caregivers because I thought I'm getting everything that I needed. That was the most important to me.
Lily, can you comment on, from the care team perspective, what do you think would be helpful for caregivers to know, home caregivers to know in terms of interfacing with the team?
I think the most important part is that the caregivers also need to take care of themselves. I think that needs to be really acknowledged. We ask a lot of our patients, but we ask even more of their caregivers. They're the ones not going through treatment, but they deal with the patient's side effects on a day-to-day basis. If they're frustrated, they're unhappy, they're angry, they're sad, there's no escape from that because they're not the ones going through cancer treatment. So it's only such a level of like how upset you can be, or how you can understand that. And I'm looking at one of my mutual patients, and his wife was so pertinent in like encouraging them, like, I know this is hard, I know this is difficult, but let's get through this. Why don't let's go over it? Maybe we need a visit with the care team, and help you understand that maybe this is normal. Maybe there's other solutions, right? Maybe there's other pain management or resources we can to get you through treatment. So I feel like the role of the caregiver is vital, probably even more so than the care team who's treating you on during your active care treatment. And they sometimes forget to take care of themselves. And it's important for you to also, speaking to the caregivers of the group, eat, drink, shower, take care of yourself so that you can be in the best shape to take care of your loved one who's going through cancer treatment.
I kind of touched upon it previously, but yes, just like Lily said, it's very important for caregivers to take care of themselves as well. Same thing with practical things, right? There's things like in California, paid family leave, the federal Family and Medical Leave Act. So if you also are needing guidance on how to take time off work so that you can care for your loved one with cancer, that is something that I can assist with as well. So these kind of practical questions, or just like I mentioned, resources for the caregiver themselves. Again, within Stanford, there is the caregiver, the cancer caregiver support group. I don't have the details on that one on me, but again, also Immerman Angels, and there are some other programs that have kind of support for caregivers specifically. So if you are finding yourself needing some additional support, please make sure that you are, verbalizing that, and we can assist you as well.
All right, I'm going to toss out one last topic for us to discuss if there are no other questions. So one of the things that I think is real for many patients and caregivers is worry, fear of recurrence, those sorts of things. Can we just sort of maybe go down the line and share a little bit about sort of coping around that and things to help manage that long-term issue?
Yeah, definitely. So, I think that there are a lot of different kind of coping strategies that can be utilized. These all kind of take some time to develop, and they look differently for everybody. But really, I think part of it is being able to get that support. Again, I'll plug in the head and neck cancer support group. We actually just had a conversation, I believe, a month or two ago, just completely revolving around the anxiety about scans and reoccurrence and all of those things. So I think being able to connect with others that have those same, kind of experiences and fears can be a good way to feel less isolated and be able to kind of learn what people do that kind of helps them. I think that the other thing is that, there are also other resources like counseling available as well, both within Stanford and outside of Stanford. So if you find that it's not just some nerves that you're feeling, but you start to feel like this anxiety is really interfering with your life, you're not able to think about anything else, that's really when it's important to be able to implement some of these kind of additional resources and tools like I mentioned, counseling. The other thing too is Stanford has some great, I think they changed their name. It's cancer wellness classes now, but they have really a bunch of classes that teach you kind of specific tools like a mindfulness meditation class. They have gentle yoga, really these other kind of strategies that can be helpful to implement, whether you are in active treatment or post-treatment and are, having some of those fears come up. So there are a lot of good resources out there. Just don't be afraid to ask if you are struggling, or even if you're not struggling and you want to learn more, it's always good to be proactive as well. If you're able to kind of learn some of those coping tools like guided imagery or meditation, or just even breath work, it can be helpful for when you do get to those moments that you are in a little bit of a higher distress than normal.
Yeah, that's always a tough one, correct? Because let's be honest, once we get to that point, and even when we get to that point when we're really loud, we keep it usually for ourselves as long as we keep it, because we think for many reasons, you don't want to burden your loved ones. They are already burdened. They may have the same problem, correct? You think you're strong enough to handle this. But, well, anyway, long story short, I'm sure we all reach the point when we realize that enough is enough. And again, I think I just echo, if you can talk to someone, your fellow patients who already went through, so who can tell you, yeah, sure, I went through, and I understand where you are, but there will be a light at the end of the tunnel for this or that reason, and I can give you my perspective on that. That's extremely helpful. If you have a relationship, and that I was, again, lucky to have that relationship, almost my care providers, but of course you have your favorites, and I have my favorite, but I want to. And it was not their job necessarily to deal with my mental thing, but at one point I really wrote a long letter to the one who least expected to deal with this problem. And we didn't abuse too much each other's time, because it was not his primary role as a particular physician to cope with my mental problem. But I got a few good and important, as one could get from your fellow physician. And first and foremost, what I found, the third was very important to me. I had a very good friend at some point, and I was on the phone with him for many, many weeks. And we just talked about, after a point, many, many things, many diverse things. What did you read? What did you see in the TV? How do you feel? Maybe you should take another couple of pills, It was very diverse. But we had good long talks, and without that, I think I wouldn't be here today. I dare to say that. And he went through something similar as well. That's not the point, but if you can find at least 3 of these, very diverse again, a fellow patient, a good friend, not necessarily a family member, because they all have. I mean, I know my wife went through pretty much the same like myself with this, correct? I know what was the burden on her as well. And that again, if you can build a similar relationship, when in key moments you need to ask even a little longer question, either verbally with any of your physician or caregiver, that can be helpful.
From a care team perspective, in terms of anxiety and concern about recurrence, I think our role as a advanced practice provider is we see patients after treatment. We're here to reassure you. We do clinical exams that, your imaging doesn't show recurrence, your physical exam doesn't show recurrence, and that having anxiety related to recurrence is normal. I don't think you see the big C word and you forget that you've ever had it or had treatment. So it's normal to continue to feel that way. We try to reassure with our exams. We go through your medical history, what treatment you've had, to help explain maybe some of the symptoms you're experiencing. I think it's really hard to do a lot of prep work in your initial phases of your diagnosis. Everyone's giving you lots of information, 1,000 miles per hour at a time. You're going to get osteoarthritis necrosis. You're going to have swallowing disability. So as a clinician who's performing survivorship visits and tumor surveillance visits, we go through your medical history and we look and see what type of cancer you've had, what type of surgery you've had, what type of chemo and radiation you've had, where did you have it? Is it just the neck? Is it both sides? Is it to the cheek? Is it to the mandible? And we're able to sort through the information that some of the other clinicians have shared, that you may have brain fog related to chemotherapy, immunotherapy. You may have dental disease because of the radiation. Things that you don't know. I bring this up to my patients every time. Are you seeing your dentist regularly? I remind them. Do you have an established visit with your speech therapist? Do you have a visit with your primary care? Getting back in to see your primary care provider. We're your oncological team, but general health maintenance is also really important. And reestablishing care with your primary care provider is something that we stress. So hopefully, by acknowledging all your symptoms, taking the time to answer your questions, we can relieve some of that anxiety. When we order imaging, we try to set up a follow-up appointment, telephone call, somewhere in the lines of within the week of the image itself, to help alleviate the anxiety related to imaging or your testing or your test results and whatnot. So I would say I'm so grateful for our patients who take the time to join the support groups, who volunteer their time to share their experience, because as a practitioner, I can only share from our perspective, like what the potential outcomes are based on evidence and research, but I can't share the patient experience. I have not gone through that myself. And so it's very invaluable for patients who are willing to share their experience with them to take the time to do that. I thank you for your time. I'm always chatting with patients. I've had one patient share with me after their chemoradiation treatment that Spindrift helps bring their taste buds back. But that is like anecdotal. I don't think there's any evidence research based to explain that. But for some patients, that has really worked, and I've shared that. But these are the things that you can get from, support groups, patients going through different time, like a different part of their timeline. Someone maybe who's just about to start treatment, someone who's just finished, someone who's 10 years down the line. And they have different anecdotes and treatments. And, hey, did you talk to your dentist about this? Because I heard that this was like the new thing, or these aren't things that as a clinician that we're aware of sometimes. Our patients are always sharing referrals, patients who need new teeth, an obturator, which is a plastic device for patients who lose part of their palate. Some patients lose part of their organs and they need like an anaplastologist, someone who creates like an eyeball or ear or things like that. And we use those referrals and we keep a track of them. And we share that resource with our patients who are looking for that.
Great. Thank you all for a fantastic panel.